Hey everybody, welcome to Wednesday Night Live. I can't believe a whole week has gone by. I'm Dr. Duncan at Siskiyou Medicine. I'm joined by Ron Veitel, and this is Pat Dykes. Pat Dykes has Pat's Rainbow Reflexology, and she works here at Siskiyou Medicine. Pat has an amazing service and provides such a great service. I've actually had treatment by Pat, and it is one of the most relaxing treatments, if not anything else. It's very relaxing. Working on my feet and telling me what's going on with my body by how my feet feel, which is very interesting to me. And it was a great treatment. Came out feeling refreshed and had some more information regarding my health. So she's here tonight, and we're going to talk to her a little bit about what is reflexology and tell us a little bit about your practice and sort of what you do.
Yeah, like your background. How did it all begin, Pat?
Well, I'm a nurse by trade. 40 years plus experience, and I got into doing alternative things. Started with, before I became a Reiki master, and then I studied different alternative things like healing touch practitioners, you know, for nurses. And then I got into the reflexology, and I do the Tibetan massage, which is going with different pressure points. And I do treatments with the Tibetan bowls, because you can do treatments with sound healing, and then I have a biomat that has amethyst crystals in it, and you can use that for the heat, and that helps to relax the
So you're pulling in quite a lot of experience together, it sounds like. So the nursing background, for how many years did you say you were a nurse?
40.
Wow.
Plus.
And you worked in some interesting places, did you not?
I did 10 years in bone marrow transplant at Johns Hopkins Hospital in Baltimore, and that's really where I learned to work with energy, because I could work with the cancer patients. We did research, and I learned how to work with the different techniques and things and practice on my clients, because I had access to all of their lab results, so I could see what I did, if I could bring their counts up or bring their counts down.
Wow.
You know, and just make them comfortable. And I did that for a couple of years because I worked the 12-hour night shift, so I could have someone, you know, cover my other patients, and then I would work on these patients to, especially if they had a lot of pain and they could relax.
Oh, what a service!
Yeah,
what a service.
It was a learning experience for me. It was really good.
Okay.
And then after that, what did you do after that?
I did 10 years of hospice nursing. I was a case manager, and sometimes I would have up to 25 people to see in a week. You're supposed to have 10, but I would have at least 15, 18 patients, and I managed all their care.
Wow.
That was really fun, and traveled out into the country, you know, out to the farmlands, and some of them were in different places and things. And then we had our own hospital that we could put our patients in at the end of life.
Wow.
Yeah.
What an experience.
It was.
Yeah.
They were really ahead of their time.
And where was this?
In Maryland.
In Maryland. Okay. Wow. That's fascinating. So you've actually got a lot of real experience in a clinical setting.
Yes.
And got to see some really sick people.
Yes.
Right? So I think that sort of gives you an advantage, at least in my opinion. And I think I could feel it in your touch, like you have almost like a knowing of the body.
You do, because you learn how to work with different things, especially if you have access to all their lab things. You can see what's affecting them. And working at Johns Hopkins, that was a really high technical place to work. Each room could be converted into a critical care room, and you'd have all kinds of, you can't imagine how many meds that they would be getting, because you have to take all of their lab, all of their blood counts down to 0 before you can reinfuse the bone marrow. And it gave me a lot of experience of seeing what I didn't really like, you know, because some of them probably would have done better if they had never had the chemotherapy.
Right.
Did the doctors ever think that what you were doing was too effective, and you just
they didn't know, because I did it for a couple of years, and nobody really, the nurses I worked with knew, because they would cover some of my other patients if I was working with somebody, because it wasn't really part of their protocol. And so I would
So you were doing this under the radar.
I was doing it on the radar until the lawyers came after me. And I still did it if I thought somebody was in pain and the morphine drip didn't help them with the pain, but I could come over there and do my touch healing or whatever, the healing touch, and get them so they could relax and sleep. But
what is it about human touch that's so powerful?
you transmit energy. I think it's almost like transmitting love. I mean, you could. People know when you care about them.
Yes.
And I think that was the difference, because some nurses would have patients there, and sometimes they wanted you to come in there and just pray with them. I had this one nurse, one patient, wasn't one of my, because we usually follow the patient each night, you know. If she was part of your team, you followed her because you manage her care, even though in the hospital. Because the nurses in the hospital there at Hopkins, you're trained, you are their spokesperson. And if someone was in pain, even with the morphine drips, you could come in there and do some of this touch healing, because that's what it was taught by nurses for people in the medical field. And you could help them relax, and they would be able to sleep.
Can you tell us a little bit about what healing touch is?
Healing touch was taught by nurses who had their PhDs and who were instructors. And it's just learning how to work with the energy and bring the energy up. You clear the chakras, the energy centers, but you just bring that up so they can do their own healing. It's just it's a touch thing. You don't have to put your hands on it. You can do it off the body, but you can transmit it. And it's just, you just concentrate on what you're doing. Energy goes where the thought goes.
Right. Right.
And so if you wanted someone to feel comfortable, all you have to do is just, touch a couple places and bring that energy up, and then they could relax. They know the difference. I don't know what it is with patients and things, when you touch. If you really care about someone, then just the touch of the warmth, the warmth of your hand, or the hug. A lot of people don't do that.
Right. Going into the hospital, it's kind of a very sterile environment. It's a scary place, especially if you have a terminal illness, right?
Yeah.
If you're really sick, it's got to be.
Yeah.
And to have someone like yourself to come in and to really make that connection with somebody, wow, that's super powerful.
It is.
It's really powerful.
And there at Hopkins, I had a chance to work with people who came from all over the world. So I had a chance to see what colors of clothes they wore, their energy and things, and it was a learning experience for me. To me, it was case study, because I had access to all of their labs, all of their x-rays, MRIs and things, so I could see the difference in what was going on and what kind of chemical.
So you had training in the field, like really intense training, and then you got to see on a practical level of what was happening based upon the touch you were using, right? And the methods you were using.
That's right. And I could see, if I wanted to bring their counts up, and I'm sure that would probably mess with some of the research that we were doing, but I could, when you give chemotherapy, the chemotherapy doesn't take the tumors down in just a few hours. But with touch and stuff, and the concentrated the energy and things, you could see the difference in that just by touching. Between morning and night, the tumors would shrink and things. The chemotherapy didn't do that.
It wasn't that fast.
No.
Okay.
No.
Interesting. Well, there's something to be said about that.
Yeah.
And is that why the doctors didn't want you doing it? It was because they started.
No, they didn't
noticing
really
that?
know. It was the nursing department that came after me.
Oh no.
I went around and gave talks to some. I was invited by this one doctor who believed in healing touch and things like that. And it was a group of doctors. There were like 12 doctors in there, and they just rolled their eyes. I was telling them about this case study that I had worked on that wasn't in our unit, but she was from Nova Scotia. She had bilateral breast cancer and reconstructive tissue. And I did a healing touch on her the night before her surgery, the day of her surgery, with hands off, and then I came back the next week, and she went home in a little over 2.5 weeks. She was supposed to stay there for 6 weeks. So I was invited to talk to the surgeons about this. I was trying to get someone to pick up my research. I was keeping research. I wanted to publish my research.
Records.
Yeah, I was keeping records, and I wanted someone to pick it up, but they just kind of rolled their eye and poo-pooed it.
Wow.
So, but then I went around and talked to different. A lot of people knew I was doing it. You know, the nutritionist that she knew, and some of them would come to my house for treatments just to see what I was doing because I was learning. You know, I wasn't certified in anything yet, but except for Reiki, and I was just learning how to treat some of these people.
So how long have you been doing Healing Touch for?
For 30 years.
For 30 years?
Yeah.
30
Wow.
years of
30
Healing Touch.
year
Okay.
practitioner.
Yeah.
So if you want an experienced practitioner in the realm of Healing Touch, Pat Dykes would be a wonderful
It sounds
person
like,
to come
yeah, right?
see here.
So
Yes.
yeah, if you're just struggling with things, you know, stress or you know, some muscle pain or just some simple things in comparison to terminal cancer and bone cancers, things. I mean, if you were helping someone with bone cancer, it seems like any of us out there sort of struggling with some seemingly menial, you know,
Issues.
illnesses, issues, boy, you could probably make a huge difference, right?
Yeah.
And even when my own experiences, gave me an opportunity to relax and to
Yeah.
sort of get into a
Mhm.
parasympathetic state where all the healing and rejuvenation takes place,
Rest, digest, and repair.
right?
Yes.
Yeah, it was great, and a lot of us aren't taking breaks anymore.
Right.
You know, we're just working through our day. We get home, we're exhausted. Or there's like this wired and tired sort of feeling where we're like so tired, can't wait to get home to go to sleep, and then you lay in bed and your mind kicks off and going around and around and around circles, and you can't sleep. You know, and a lot of people are ending up on pharmaceuticals like sleeping medications and antidepressants and anxiolytics and all. I mean, it's sort of sad and ridiculous, and then you know, and here you are, Jam.
So when did you get into reflexology, Pat?
About 7 years ago, when I came here, I took this course online. The school was in Canada, and it's like going through trying to do your thesis. It was a very intense course, and you had to make videos of what you did so they could see it. I had to make a video, and then all the questions and things that whatever you did, you had to keep records of all your clients. You had to have at least 10 clients and 10 visits, and you could not charge them for any of that. That was your learning experience. And then you had to tell what you felt or what you saw in each of their systems, like their heart, their kidneys, or whatever. And then you had to send all these papers in, and you had to have and then you took tests all the time on the different parts of the thing. It was really intense. And then I did that and got passed. You had to pass a certain grade, and I passed those tests. And then you had to make a video at the end anyway, your final records. And you had a book that you had to study each month, and you had videos to watch and things. And then when you got certified, I went on and took the advanced course. My plan was to get the diploma, but I didn't take the test. I just studied the different systems each month, and that's what I do now. Is the European type, because you're working the system. You go back and forth, and you use the cream because you can feel the energy better if you're going up and using the cream.
So you're using something on the person, on the foot.
Yeah.
Okay.
So for those who aren't familiar with reflexology and what it is, could you give us an overview of what
Okay.
reflexology actually is?
Reflexology is just touching the pressure points. Each foot, there's 7,000 nerve endings in your feet. And whatever's on the left side goes all the way to the head, and whatever's on the right side goes all the way to the head. So you can touch different parts in there, and you can feel if they have a stroke, it's the top of the toes. You know, if you want to use something, you know, to stimulate their head or something, that's where you would do it. Or you can see if something's out of balance, like the pituitary gland is right in the middle of the toe, the big toe. So you could feel one side, and if it's sore on that side, you know there's something going on, but you can send energy in, and you can balance the right to the left, and that's what I do.
Okay.
If I feel the energy is weak in one place, I will balance it with the other side.
Okay.
So the nerve endings come into the feet, and then each nerve ending, depending on where it is in
There's
the
a pressure
foot,
point.
is a pressure point that is connected to a specific organ in the body or gland in the body. And so by stimulating that nerve ending, that will send messages from the nerve back up to that particular
wherever it
organ.
was, yeah, right,
And you can affect change.
yeah,
Through the feet.
through the feet, yeah.
and to have your foot rubbed or your feet rubbed is just amazing.
Yeah.
I mean, that's
Or
like the
touch,
side benefit.
right? It's like the side benefit, right? But you can tell if someone's small intestine is dysfunctional,
Yeah.
whether their adrenal glands are depleted,
Yep.
you know, and we're gonna be talking a lot about adrenal glands this month and the immune system. So,
Yep.
you know, and
Yeah.
I'm afraid that people going into the holiday season are going to burn themselves out. So I bet you can.
Yeah, you
feel
can
that.
you can feel it, and then you can also do it on the body, because the kidneys are back here and the adrenal glands here. So sometimes if I think someone's adrenals are bad, I can put my hand under their back and stimulate that. I send energy in. Energy goes where the thought goes.
And when you say you can feel it in somebody's foot, what do you exactly feel?
It feels if something's out of balance, I can tell if it's weak. You know, it just feels like there's something there. But what I really look for and feel in the feet is like, it feels like little grit. It's like little sand grit. So if I'm going down, like say this part of the foot is the nerve, for the lungs, and if you come down and you feel like there's something there, you can stimulate that in the lung area, you know. And then if I feel like something that really needs to, sometimes I use my Tibetan bowl.
Oh, so then you'll bring out your Tibetan bowls.
Because you can do healing with sound.
Okay.
Right.
So you incorporate a lot of things into
Yeah.
the session that you provide. So is
Whatever
there
they need.
any contraindication for reflexology? Is there like a patient, a perfect patient, or a patient that may not be a candidate?
Or
Well-
even a point that might be contraindicated for
No.
people.
No, you can do pretty much anything. So I do ask people if they're on blood thinners, because then I don't press as hard. I just want to make sure I don't. But if they have anything like a DVT, I probably wouldn't work on them. You know, something that I know.
DVT,
Yeah.
DVT meaning a clot in the
Clot
leg.
in their legs.
Right?
And they might not know it. So
Right.
if I could feel,
And with your nursing background, you
I know
probably
the symptoms. Yeah.
key onto those red flags, right? Which is just amazing that you have
Yeah,
that
'cause
background.
You can assess somebody. I look at their breathing. If I think they're having apnea, I will time it and tell them they need to go and have someone look at that, because sometimes people aren't aware that they actually have apnea. And you can tell by the color of them and looking at them and things, and you can just kind of see where things are if they're having some health problems. I'm not really able to diagnose cancer on the feet, but if I feel something's out of balance, hands would tell me, or that they need to have someone else look at something to go to a doctor. Because I've done that with some friends that ended up having cancer, and I didn't know it. I just knew something was out of balance, and so I told her to go see her doctor, and then she had breast cancer, and we didn't know it.
Wow.
You know.
Wow. Fascinating.
Yeah.
Fascinating.
Yeah. She was grateful. I said, well, there's something not right, because when you look at someone, I can see people's auras. Not all the time. It depends on how the light is. But sometimes if you see the energy is close to their body, or if there's like a gray around their body, they're really sick. You don't know that. And somebody could still have something really wrong with them, but their energy is clear around them. So they're in the process of healing.
Wow.
You know.
That's fascinating that you get to see that. And I'm sure with your 30 years experience, you've sort of fine-tuned
I have
the
studied.
instruments, right?
I have.
Yeah.
I've gone to the malls and just watched people come up the escalator to see what their energy was and what colors they were wearing, because the colors also have healing.
Yeah. I wonder if anybody has any questions. I'm going to check the screen and see if
Okay.
we have any questions for Pat. But if anybody has any questions regarding reflexology, please shoot us a little text here on Facebook Live. So just scoot your money in here. So what? There's a question. Any comments about today's news about synthroid and lung cancer? So we'll get to that later. What are the health benefits of reflexology? Is another question.
It just helps you to heal, helps you to balance. It's just another alternative method of whatever. It doesn't interfere with anything. Whatever they're getting, you know, like if they have some other kind of treatments, and it just complements whatever they're doing.
Would you say it's tonifying for the body?
Yeah,
Is that okay?
it helps them to heal better.
Helps them to heal
What
better.
does it stimulate an immune response or a healing
Yes.
response?
It
Okay,
does.
so probably.
So I usually tell people when I work on them, especially if they've been on my biomat, and I turn that on because that helps you to also to detox. And what I do at my feet helps you detox. So I tell people they have to drink more water, and if their feet or anything hurts them, that's a healing process they can go through. I've only had one person in 7 years complain about that, but you just drink extra water, and by the next morning that'll be better.
So you've mentioned the biomat a couple of times now, and that's intriguing to me. So can you tell us what the biomat is?
The biomat is full of amethyst crystals. It heats up. It has negative and positive ions. It was developed. The technology was developed by NASA. And then the biomat is used in Japan. They use it for their cancer patients. They have it actually on their beds in the hospital, which we don't do yet. But it helps you to balance, and you can turn the heat up or you can turn it down, but it helps you to detox.
So it's detoxification.
It does, and it helps to circulate. If you see the pictures of people who've been on the biomat before and after, and the circulation in their legs or their chest, it's remarkable, the difference.
So it improves circulation.
And helps you to detox.
Helps you to detoxify. Okay.
Yeah, and then you mentioned the bowl. What tell us about the bowl?
Yeah, the bowl is. I took some courses in learning how to use sound therapy with the Tibetan bowls, but and it's taught by a Tibetan monk. He comes here to Ashland. I took the course in Ashland. The bowl that I use is made out of 9 different kinds of metal. It's all handmade by the Tibetan monks. And you just hit it, and the sound, if you put it on the body, it goes all the way to the back if you put it on the abdomen and things. And you can do different healings with sound.
And I got to experience the bowl.
Oh, did you really?
Yeah, it was wonderful. So she put it on my abdomen, and then tap the bowl, and the sound literally travels through your body. You can feel the vibrations.
Yeah.
It was very nice.
Yeah.
Very nice.
I use it on people if they've had back problems and things like that. It just depends on what else I need to do with them, you know. I don't use the bowl on everybody, but if they want to try it, I do. I like to gong it.
Yes. That was awesome. That was so good. Yeah. So so you use the biomat, you use the bowl.
Yeah. And then I use the Tibetan massage that you go like that. If there's because you can do it any place on the body.
So you give people
different
tools to use at home, right? So you'll educate people and
I
teach
do.
them how to use
Yeah.
this.
And then the other thing I use is the shungite. It's really 98% mineral. That little thing, and that helps to balance the energy. And I've used it on some of my cancer patients and things, and to see if they can feel it and things, and that helps to balance some of those things. So I use a combination of. If I use it on people's feet who have neuropathy, it helps to bring the circulation and their feeling back.
Wow.
Yeah, I've used it on people who.
Right. So diabetic neuropathy. Okay.
Diabetic.
So that's fascinating. Yes. Good.
We have about 5 minutes left. It's amazing how fast a half hour can
So
go.
if people want to schedule with you, how do they do that, Pat?
To use to call me on my cell phone on the business card, you
On
know.
the brochure? So.
Yeah, or the brochure,
Okay.
yeah.
Alrighty. So,
Or if they want to stop in here and talk to me.
okay, so you can stop at Siskiyou Veitel Medicine and schedule with Pat, or if you'd like to have a conversation with her, you can come by, pick up a brochure, pick up a card. Do you have your cards or brochures anywhere around town?
No, just
here.
Well, Soundpiece used to have some of them up there. I'm not sure if they had the brochure, but they had the business card. But usually just pretty much here.
All right. Well, so we're Siskiyou Veitel Medicine. We're at 940 Ellendale Drive in Medford, Oregon. Our phone number is 541-210-5687. So if you'd like to call us, we can connect you with Pat. And I really appreciate you being here. It's just really nice to have you here and have this option available for our community. So we're a naturopathic direct care practice here in Southern Oregon, and we're happy to provide a space that we can have Pat and Ron and other things happening all the time to really bring something more to the community, another alternative piece. I think a lot of people are missing some of the adjunct pieces to their health. I mean, there's the conventional side, and there's like you had mentioned, cancer, and there's the very chemotherapy side. But there are so many other therapies that we offer here that can sort of complement that and help someone through the difficulty, whether it be the treatment or the side effects or the disease itself. So thank you for being here.
Yes, thank you, Pat. It's great to have you at the clinic.
Thank you.
Yeah.
All right, guys. Well, that ends our Wednesday Night Live session for tonight. We'll see you next Wednesday night.
Did you want to answer the question on thyroid?
Oh, thyroid. So maybe we'll save that topic. I can actually message on that topic because there's news today. So I've been seeing patients all day, so I haven't seen the research that's referring to.
Excellent.
But synthroid and thyroid cancer. Just quick, synthroid really doesn't address what's going on in the thyroid per se. It can just replace the hormone. So, I'll delve into that a little bit. Maybe you can take a look at that too, and we can come together and have a short clip about that particular piece of information next time.
Yep, that would be fantastic.
Great. All right, guys.
Thanks
a
everybody.
lot. And we'll see you later.
Have a great night.
Bye.